So we have multiple partners at different geographic sites around the globe, some of which are in India, some of which are in Kenya, and then others in South America, including Chile and Bolivia. And we also have some partners in Colombia as well. And so one of the things we do, one of the missions of the center, is to get bilateral exchange of scientists. And that's primarily in the areas of education, research, and then training. And so what we do is we have partners from those international sites come here and train in our laboratories here at UNM. In addition, scientists from UNM go over and train at the laboratory facilities that we've established at these different international locations.
My institution's mandate is looking at global health as well. It's actually a center for global health research. So partnering with the Center for Global Health at UNM basically gives us the opportunity to share with them the factors that govern global health. And more importantly, the biggest value is the capacity building aspect of it.
So one of the things we'd like to do is, in addition to just being a group of individuals in internal medicine, what we've done is we've expanded out across the university, which includes main campus, as well as some important branches of medicine here at North Campus. And that includes emergency medicine and guys like Daryl Maxius.
So I'm excited about the work that the Global Health Program is doing here at UNM, and I hope that we can collaborate with internal medicine even more. One of our deficiencies with emergency medicine is we don't do much bench work research, and I see a lot of potential with what DJ has been doing in Kenya, for instance, in malaria. And ultimately our goal is to, though we're specializing in the non-communicable disease aspect of global health, we hope to bolster some of the knowledge base for fellows, for residents, for medical students, to also include some of the communicable diseases that we're eradicating, but we feel that both a complementary mix of communicable diseases, non-communicable diseases, and even some things that have domain of public health, such as nutrition, might be something we'll consider on learning. However, I don't think we'll be able to replace the knowledge base of our internal medicine friends, but at least to have a good knowledge of that would help.
The value of having the international partners is largely because they bring really rich knowledge about the problems that affect their populations. And by training them in some of the scientific methodologies that we use, they can then go back to their home country and apply those principles and improve public health.
It's a great opportunity, in fact. We just saw a video of my city saying Rajkot is a land of opportunities. There's tremendous potential inside our city, specifically in our institution, the PDU Medical College where I work, and the AIT Center. They have so many branches in which there's so much work left to be done. We've got a gold mine of data. The number of patients is staggering. The number of people who come around and the data that we're able to generate is tremendous. Where we fall short is analyzing and putting the data in the correct format so that it can be shown to the shared with the world. And when the people from Center for Global Health came there and they tried to explain to us about how to analyze the data, that is probably a bilateral exchange that we are aiming at, that there are some things that we need to learn from here and some things that people here would get to learn from our center. And that is probably the core of development of both the centers.